Quarantine for close contacts of COVID-19 cases could be removed altogether if a recommendation by Australia's top public health officers is adopted by state and territory governments. Key points. The National Cabinet asked the National Public Health Committee to look at how COVID-19 quarantine could be removed. The National Cabinet asked the National Public Health Committee to look at how COVID-19 quarantine could be removed. The committee says it could be removed if risk mitigation procedures are followed by close contacts. The committee says it could be removed if risk mitigation procedures are followed by close contacts. SA's Chief Public Health Officer has called for a nationwide approach. A statement released by the Australian Health Protection Principal Committee last night says quarantine could be replaced with other risk mitigation measures for close contacts once the peak of the current wave of the BA.2 Omicron subvariant is over. Cases of the subvariant are expected to peak in NSW, Victoria, and South Australia as soon as next week. A meeting of National Cabinet last month had asked the AHPPC to provide advice on how each jurisdiction could best manage ditching the quarantine period heading into winter. The AHPPC said quarantining could be replaced with frequent rapid antigen testing for close contacts, wearing masks when leaving home, working from home, avoiding high-risk settings, and monitoring for symptoms. Where quarantine is required, 7 days remains appropriate at this time, the committee recommended. People with COVID-19 or symptoms of the disease would still have to self-isolate. Call for consistent nationwide approach. South Australia only cut the required close contact quarantine period from 14 days to 7 days last week, matching the requirement in other states. The state's Chief Public Health Officer, Nicola Spurrier, who sits on the AHPPC, said today the committee was quite keen to have a change across the nation this time. At some point nationwide, we'd like to move to a place of not requiring quarantine for close contacts, Professor Spurrier said. We'll be watching very closely, but not just in South Australia. We do want to move on this as a nation, she added. Nicola Spurrier, at a meeting of South Australia's Emergency Management Council last week. Following the National Cabinet meeting on March 11th, Prime Minister Scott Morrison said he believed isolation rules for close contacts of COVID-19 cases were redundant. We've tasked the medical expert panel to say we want your urgent advice on this as soon as possible, because we'd like to say goodbye to that rule as quickly as we can, he said. The AHPPC met on March 23rd, but only put out its recommendations yesterday. It said removing quarantine requirements could lead to higher caseloads and a reduced capacity for the health system to provide some acute and elective services. It noted that other countries that had removed quarantine requirements were experiencing significant societal and health system disruption arising from increased rates of infection. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 15 minutes 2 seconds 15 M. Will winter bring a COVID-19 onslaught?